My name is Ashley Lamb. I work with the Albemarle Commission Area Agency on Aging, and we serve adults, so 60 and older, as well as caregivers. So I did put one of our brochures in the packet. So if you are interested in learning about some of the programs and services, we do cover a 10-county region. You know, you have that information and you can contact our office. Because of the population we serve, we work very closely with the senior centers in our region, and we also work with the Seniors Health Insurance Information Program, the SHIP that was referred to in the video, as well as Senior Medicare Patrol, SMP. So I just wanted to come today to share some information about the SMP program specifically, and I did put all the handouts I'm going to touch on in the packet, so you have all of that information. Don't have to worry about, taking any notes. So as you heard in the video, SMP has been around for a while. It's Senior Medicare Patrol. It's been housed at the North Carolina Department of Insurance in the SHIP division since September of 2003. So the whole goal of that program is to empower seniors to prevent healthcare fraud, waste, and abuse through education and outreach. So in North Carolina, we have our SHIP volunteers, and they're the ones that provide the counseling assistance, the free, unbiased information about the available options for your health care. We're all cross-trained as SMP volunteers as well. So we're really looking at both sides. And all of those services are going to be free to you. So if you have not already taken part in some of those services, know that they are out there, and I encourage you to do that. Does anybody remember how much money that Mike Causey said was lost to Medicare fraud last year? Oh, y'all are awesome. $68 billion. That is a lot of money. A lot of money that we do not want to go to waste. And even when you think about the breakdown, that was last year. Think about how much money that is in a single day. That is a lot of money. So again, the whole purpose of SMP is to kind of empower Medicare beneficiaries. And so, through all those efforts, we really want you to be good stewards of your Medicare benefits so we can prevent some of that fraud and waste. So one of the very first handout I'll have in there, and just want to touch on it, looks like this. It's, back to the very basics. What is Medicare fraud and abuse? So you've got two definitions there. You've got Medicare fraud, which that is going to occur when a person or company knowingly tricks Medicare. So they're doing that on purpose. They're doing it intentionally so they can receive inappropriate payment from the program. You also have Medicare abuse, and that's going to occur when a provider seeks Medicare payment that they don't deserve, but they're not necessarily knowingly or intentionally doing that. And so that can also involve billing for unsound medical practices. The main difference is just going to be the intent, where Medicare fraud is knowingly, intentionally, and Medicare abuse is not. So the main thing that's important for all of you is just knowing what you can do to stop Medicare fraud and abuse. And all of these things I'm going to mention are kind of listed on the back of this handout here. One of the most important things is just asking questions. Hopefully you all have a good relationship with your doctors and specialists, and you're in the habit of that partnership and asking questions about, care and treatments and medications anyways. But don't forget that also includes costs. Get in the habit of asking about costs, for some of those services. Another thing that was actually mentioned in the video is the healthcare journals. I did not have enough of these in my office to bring everyone, but I do have an example. These are put out by the SMP program, and they're really neat if you've never seen one. They have a lot of good things that you can fill out in here. It information about yourself, your personal information. You can list appointments that you have upcoming. You can list medications. If you have things you want to bring up to your doctor, that's a good place you can put that in and bring your healthcare journal out and have those conversations. But even if you don't have one of these specifically, these are things that you can kind of replicate in your own notebook. And you're going to want to do that and help you with the Medicare summary notices. I think that the most important things are just going to be, dates, what doctor's office you went to, what might be the outcomes. Did you start a new medication? Did your doctor order a test? Did you start a new treatment? Those are the things that you want to note, because when you go to check your Medicare summary notice, you'll have all of that information and won't have to guess, is that when I got that ordered, or, whatnot. The Medicare summary notices, and you also have a handout in your packet there, they're usually sent quarterly. So there's a lot of doctor's appointments that can happen during that quarter. You get them mailed out to you. They're also available to you online at the mymedicare.gov website. You do have to create an account, but once you have that, you can access that online. So the Medicare summary notices, they're just kind of a explanation of everything that has been billed to Medicare. It might explain things that you may pay out of pocket, as well as if you have any secondary insurance, that's all going to be noted. So things that you want to be looking for are all on the back, or no, things. Yes, it's up here, but I'm going to cover them too. So, you want to use that healthcare journal to be looking, are these things that I actually received, and at those dates, did your doctor actually order that service? Does that service have anything to do with whatever medical condition you may have? When you receive the Medicare summary notices, it says on the outside, this is not a bill. So a lot of times, because we know it's not a bill and we're not owing any money, people will not open those. They'll just shred them or disregard, pile them on a table and not pay attention. But it's so important to actually open those when you have time, review those, check them, and make sure that everything is correct. If you ever suspect that you've been a victim of any fraud or abuse related to your Medicare, you definitely want to report that. And the number is actually on all the handouts in your packet and was mentioned on the video. It is 1-855-408-1212. You also have, as we mentioned, the SHIP counselors are also SMP cross-trained. You also have some great supports locally that can help you with filing too. So as there are some things that you do want to do, there's also some things that you do not want to do. And I'm going to be repetitive here because I think it's important. It was mentioned in the video. You do not want to give your Medicare number out. That's not necessarily a number that everybody needs. You should only be using that with your doctors, specialist, hospital. Of course, if you're working with a SHIP counselor, we might need the number to set you up an account, but that's not something that everybody should need. You should really guard your card while you're out in public, just like a credit card. And this is another SMP resource. I did not have enough to bring to such a large group, but you may have seen these at other events. But this is like a little card holder with SMP. So, this is what our Medicare cards look like. And, it is a great thing that we don't have Social Security numbers on there. We do have a unique set of numbers and letters. But still, people can do a lot of damage with this. So you want to make sure that you're hiding this. You don't want anybody to get this number, just like you don't want anyone to get your, debit cards, credit cards, Social Security number. So the best practice that we've always taught with SMP is just to put it in the card holder kind of backwards. So then the back of the card shows. And the reason that, we always give is these cell phones You're waiting in line at the pharmacy or you're at your doctor's appointment. Everybody's walking around with phones and, technology is great. People can snap pictures of things like that and use that to charge things on your Medicare or, cause harm. So just want to be very protective of that number. Just as it mentioned in the video, telephone, door to door, though Medicare is not going to be calling you. They're not going to be knocking at your door. So be weary of, anyone that's calling you saying they're from Medicare or knocking at your door. Especially don't want to give your number to anybody like that. You don't want to accept any free medical services. Of course, they're not going to be free. If it sounds too good to be true, it is. So just be weary of that and not share that number. There's some scams that are out there that were actually mentioned in the video, and I have some handouts for you. One of your handouts says stop prescription drug scams. I don't hear about those as much, but I definitely want you to, have that and know that you have that resource. One of the things that were mentioned were the durable medical equipment, and I see that a lot. The catheters, as was mentioned, was a big thing. We had a few years ago a lot of neck braces and back braces and things like that going on. But the main thing is most people don't need that equipment. If you don't need that equipment, you have no benefit for it, and you don't want your Medicare charge for that. When it comes to durable medical equipment, as it said in the video, that is going to have to be ordered by your physician. So you're going to see your physician in person. They're going to order that for you. Some of those supplies, and when I say durable medical equipment, I'm meaning, hospital beds, wheelchairs, home oxygen equipment. What are some others? Walkers, things like that. They're all reusable things. Medicare does cover those, but again, they have to be ordered by the physician, and they have to be ordered from an approved supplier that's actually enrolled into the Medicare program. Medicare is going to cover 80% of the approved amount for those items. So, again, that's what you want to be careful of. People will get calls for some of these things and, they're free, and they're not. So, again, on this form, you've got some ways to kind of protect yourself. That's another way you can check your Medicare summary notice just to confirm that nothing has been ordered with your Medicare. Never sign anything from any healthcare providers or equipment suppliers, especially any blank forms where you could be actually ordering some of those things without your knowledge. I think most of them are kind of across the board with all the scams, hiding your card, not talking to people that call you or come into your door, reading your Medicare summary notice, referring to your doctor. So it's the same with this durable medical equipment. But I just wanted to bring it to your attention since it is such a, hot scam lately. Another one is the misleading marketing. And as a Medicare counselor or SHIP counselor, I see this a lot. And so I want to bring that to your attention as well. Health insurance companies, they do try to get their information out. They try to contact you, and it seems like there's more and more and more every year. You see the TV commercials, you see like social media ads, you probably get lots of things in the mail, especially during that open enrollment period. The calls, they even text. So, those are all the ways that they're going to be trying to contact you. The Centers for Medicare and Medicaid Services, they actually have rules for marketed Medicare Advantage plans and the Part D prescription drug plans. And those rules are in place to protect you all as Medicare beneficiaries against any misleading marketing or aggressive marketing. So you want to watch out for anybody that's calling you, again, asking for your Medicare number, your bank information, especially if they're asking all of that before you even decided to enroll. I hear a lot of beneficiaries say they're contacted and, give me your Medicare number. I got some plans that I think might work better for you. You can put this $170 premium back in your pocket, and, we can offer you a, pharmacy card and, all of these benefits. So just be wary of that. Also be wary of anybody that says they represent Medicare. The plans are not allowed to state that they represent or they are endorsed by Medicare or any other government agencies. Be careful for anybody that's sending you any unsolicited calls or text messages. I've seen a lot more of the text messages recently. And sometimes they can, really pressure you. Once they give you the information and they think that you might be interested, they will, text you more frequently to kind of pressure you to go ahead and enroll in the plan. That is not something that should be happening. So, try not, don't get in a situation where you feel pressured. The best practice would be to contact your local SHIP site. So we are going to be providing any unbiased answers to the questions that you have and help you to understand your coverage options. We do not pressure you in any way. So you have that resource available to you to help you make those healthcare decisions. Some of the other scams that are out there, they mentioned genetic testing in the video. That is a big one. A few years ago, when we had the transition from Social Security numbers to the Medicare numbers, there was a lot of things about plastic Medicare cards. I haven't heard as much about that lately, but that was a big thing. The Medicare card is just like your Social Security card on the card stock. So, don't have somebody call you and give me your Medicare number. I'm going to upgrade you to a plastic card, because that is a scam. During the COVID years, I think the scammers got even more aggressive, and there was a lot of things about vaccinations and upload your vaccination cards. You can get a benefit, or we'll give you a gift card. So just be weary of all of those things. As you'll probably hear a lot of times today, if it sounds too good to be true, it is. And just remember, I think the main takeaways are, Medicare does not go door to door. Medicare does not call you. And just always know who you're talking to. If someone's calling you, they're asking you for those numbers, you feel unsure, you can always hang up and call a trusted number, whether that be your doctor's office or, whoever you're talking to, or whoever you suspect you're talking to, an insurance company, your SHIP counselor, your doctor's office, hang up and call them from a number that you recognize and If you ever suspect any fraud or abuse, report it locally. That's $68 billion. We want to prevent that from being wasted. So that's the one thing we can do. Everybody be good stewards of their benefits and report it. Share this information with others. And again, you have such great local resources here in Dare County with the SHIP program and the S&P here at the Baum Center, as well as the Virginia Tillett Center. Our agency, although we're not local right here in Dare County, we serve Dare County, and we have counselors as well that is happy to help in any way. So use those resources to you. Open enrollment is right around the corner, October 15th through December 7th. So for most people, that is the time of year that you're looking at your health care, whether you have a Advantage plan or a prescription drug plan. You're reviewing that and see what might fit your needs for the coming year. So if you don't already, I would encourage you to talk to someone, and they can help you get the information you need to make the best decision for your health care.